Chronic kidney disease affects more than 35.5 million Americans, yet most people don't even know they have it. Well, we want to welcome Dr. Charles Vega, Director of Medical Education for the Latino community at UC Irvine, and Thelma, a two-time kidney transplant recipient. Thank you both for joining us.
Thank you.
Thanks for having us.
So it sounds like one test alone isn't going to find if someone has kidney disease. And Thelma, it took years for you to discover that you had kidney disease. Can you walk us through what that experience was like and what finally led you to receiving that diagnosis?
Yes, it took nearly a decade for me to find out that I had chronic kidney disease. Even though I presented to my doctor office with fatigue and swelling, it was pushed off to another condition. And so a decade later, I go back in with flu-like symptoms, and a dipstick test was done in my urine. It showed blood and protein, which is not supposed to be there. And then further testing showed that I needed a biopsy, and it revealed that I had a rare kidney disease. And once I was diagnosed with that chronic kidney disease, I also am living with type 2 diabetes, high blood pressure, and high cholesterol, because everything is interconnected and everything spiraled out of control with my cardio kidney metabolic conditions. It's been overwhelming, but I'm blessed to be alive.
Indeed you are, and you have beautiful twin boys to show for it as well. Dr. Vega, what are the typical signs when someone is suffering from kidney disease? What are the causes?
Well, in terms of causes, we think about diabetes and hypertension. That's about 2/3 of cases of CKD or chronic kidney disease in the U.S. are due to those two conditions. So if you have hypertension and or diabetes, you should be checked annually with both a blood test and a urine test. But there's still 1/3 of folks out there who have CKD who don't have diabetes or hypertension. If you have a family history of chronic kidney disease, if you have existing cardiovascular disease, you had a heart attack or a stroke, those are also indications for getting screened for CKD. The earlier we can make the diagnosis and move upstream, we can prevent downstream effects like dialysis or like a heart attack or stroke that are obviously really life-changing for so many individuals.
And if you don't know what your family history is when it comes to those things, when you do visit the doctor for, say, your annual medical exam, is this not something that's typically tested? Because we all have to give a sample, they take blood in many cases. So is this just not detected?
We don't have national screening guidelines for all adults yet in terms of screening for chronic kidney disease. So we really want to, focus on those at elevated risk. That said, you're right, it's 35 million individuals. I often will get blood testing routinely for adults for cholesterol, for diabetes. It's not too hard to include a test for kidney function as well.
Yeah. And Thelma, were you experiencing renal failure? I mean, you've had 2 kidney transplants, so not just 1, but 2, which is a little bit more rare from my understanding for people who undergo these diagnoses. But were you kind of at the edge there where your health was in serious risk?
Well, what happened was, because I'm living with the comorbidities of the other conditions, the kidney was fine. However, once I became pregnant, unfortunately, my rare disease showed back up. But this is one of the reasons why you have to continue to manage those comorbidities of the blood pressure, the diabetes, and the high cholesterol. Yeah. But everything that happened to me came back because of the kidney disease. I have a second kidney transplant in 2011, which was via deceased donor, and I'm doing great 14 years out. And so that's why I'm here with the It Takes Two campaign, because I want people to understand the importance of partnering with your doctor, and yes, asking for those 2 tests, a blood test and a urine test. Yeah. You don't know this unless you're educated, and that's why we're trying to educate you by the website called testyourkidneys.com. Lots of information and resources that you can go to empower yourselves, because knowledge is power.
Absolutely, and to be your own advocate, and that's something that you did, and you advocate for others to be their own advocates. And so, Dr. Vega, what do you hope that people get from our conversation today and from hearing Thelma's story to have those conversations with their primary care physicians?
Right, and Thelma's a great inspiration. She's a real change agent, but I think all of us should be empowered to take care of our own health. You are the expert in you as a patient. And so bring your questions, write them down, and don't feel intimidated by your clinician in that environment because they've got all the knowledge, et cetera. You know you, and I think it's very legitimate to ask questions specifically about your kidney health and if you've been screened appropriately for kidney disease and other diseases that can contribute to kidney disease. So I really admire somebody like Thelma for taking the initiative. We should all take the initiative. And I think that that's working in partnership with your clinician, I think is the best thing possible.
Wonderful. Well, thank you both so much for joining us and sharing your story, and Thelma for advocating for others to really keep a close eye on their health. We only get one chance at this, so I want to thank you so much for joining us.
And thank you.
We'll be back after this.
Take care. Thanks.
Thank you.